Hello, everyone. Welcome to a new episode of our People Power Health Insight newsletter. We are really happy and really honored of having an amazing guest speaker today. So, Dale, thank you for joining us.
Absolutely.
And we usually start with by asking our guest, like, tell us a little bit about you and how did you got involved with healthcare. But one thing, Dale, that we both know, and that I'm sure our followers and our listeners know, is how urgent right now the topic of migrant health is. So, if you agree, Dale, I will propose for us to shift a little bit the order today, and let's start talking about the topic. And in a few minutes, we can go back and talk a little bit about how you got involved with it. Is that okay?
Fabulous. I'll talk about migrant health and the needs of migrants and immigrants for hours. So please be careful, and you may have to cut me off, Sam, because it is a critical issue. And interestingly, I came to it quite accidentally. So in looking at what I do now, I find myself feeling very, very fortunate that I'm engaged in the kind of work where we're receiving new immigrants to the country, recently released from detention, who are in need of critical health care. Mostly, we're working with pregnant women and children with extreme healthcare needs because, one, they're the group that has been allowed to enter the country with greater frequency and ease. But two, those are really urgent and sort of time important, time limited
Yeah.
issues that we need to deal with. So when I look across the spectrum in this country, it's hard enough for someone who knows how to navigate the system, who has, sort of rights and access to everything. Then when we consider groups like immigrants and like migrants, where the principal funding mechanism, which was, the Obamacare, the ACA, was specifically constructed by excluding immigrants so that not even if you wanted to buy insurance, would you be able to do so. And certainly the inability to look ahead at how you might pay for
Hmm.
important health interventions, particularly like pregnancy and prenatal
Yeah.
care, is a horrible piece. And if you look at obstetrical care in this country anyway, then we're now looking at sort of a double whammy for a very sort of fragile and vulnerable group.
Yeah. No, no. Thank you for starting with that comment because my first question, Dale, was going to be involved with that and connected with that. And it's we had recently huge events happening in the US, like earth-shattering kind of seismic events happening, and there is a lot of tension right now in the environment, and there's this ongoing question about what is needed to do and how can we build what is needed for immigrants to be healthy, to thrive in the country. So I would like us to start discussing a little bit about that. In the look of recent events, what are the things that need to be taken care of?
Sam, if you look at recent events and the uncertainty of the kinds of decisions that are likely to be made around the delivery of healthcare, particularly to those who economically are more challenged than
Mhm.
others, then it is really to look at more of that position of healthcare for all. That we want to look at what is available and how you avail yourself of those services. Principally, what we hear frequently is the oversubscription of emergency room care. And that is not the best kind of care because it is really at a last resort. And it is, crunch time after you've spent a considerable amount of time waiting to be seen. And once you are stabilized, the presumption is you'll leave. When I'm asked how it is that I believe, healthcare for all can in any way be navigated, my position is you can take one of three stances. You're a humanitarian and you believe that everyone should have access to healthcare. You're an economic pragmatist, and you can understand that if you rely on emergency care, it's more expensive. So let's put our money into primary care and access that way. Or you can work from personal self-interest. You don't want to be in an environment where someone might be sick, in deep need of healthcare, and not being able to access it, and in that case, then endanger you. I don't care which of those three positions you take, it leads us to the same result, which is that we need to have healthcare for all.
That's right. No, no, no. And I love the way you frame it, because definitely healthcare for all should be kind of a motto, and something that is like a North Star that will guide us towards a specific goal. And as we talk about healthcare for all, Dale, I have a question, because you also work a lot with social determinants of health,
Right.
right? And how can we approach, as we move toward healthcare for all, to consider social determinants of health?
Sam, I've been working on this for a while, and my own thoughts on it are evolving. And while the social determinants of health are critical for us to keep in mind, I think what we really need to be focusing on are vital conditions for health,
Okay.
because those things that negatively affect a person's ability to live and thrive certainly need to be addressed. They are by and large systemic, and we can't put the onus on the person. If we look at vital conditions, and it's housing, and it's honorable and decent work with the capacity of the person to, have money, it's social involvement and civic engagement, and it is all of the things that make it possible for someone to thrive. That is where I think I need to put my energy, because some of the structures that are resulting in these negative social determinants, I'm not sure I know how to affect. But in my own communities, working with organizations that are trying to dedicate themselves to outreach for solutions around housing or work or civic engagement, those are the kinds of connections that I want to foster, because then what I'm doing is I'm doing my best to lift somebody up according to what might be of benefit to them. One of the things that I learned over time, particularly because I was focused on infectious disease, I was focused on tuberculosis earlier in my career, is that I was really focused on someone's vulnerability. Oh my gosh, they're not going to be able to access, they're going to need their medication. They're not going to be able to, stay in one place. We need to be able to help them move. But the person that I was concerned with was focused on opportunities. What's going to be best for my family? Where am I likely to have good work? Where can I find housing? And so they were focused outward on what was going to be propelling them. And I was focused downward as if they were incapable. And I found myself really at lockhead with people, because they were not focused on what they couldn't do. They were focused on what they could and where they could do it. So that was a big lesson for me in TB. And I had a patient who was living in one state and was going to move to another. But, he was in a Midwestern state, and I started working with the nurse from the TB department there. And she, boy, pulled every string she could get, because generally you have to wait 30 days for treatment to be initiated in some places. And she got him engaged in the treatment plan for her state and moved heaven and earth. And it was a Friday. And on Saturday, this gentleman moved to another state. And on Monday, when I had to call her and say to her he had moved elsewhere after she had moved heaven and earth, her response to me was, "Don't ever call me again." And so I see that those of us who are helping, who are purporting to be in alignment with the needs of others, frequently get so involved ourselves in what's happening and what it is sort of costing us, either emotionally or politically. We have to call in all of our chits to get something to happen, are then not in sync with the individual with whom we're trying to support. So the vital conditions for thriving, for healthy individuals, is really where I'm focusing my attention. Where I can have systemic impact, then that's what I'm trying to do. If there is a policy, if there is a governmental structure, if there is a regional structure that I can engage in to ask them to modify their processes, I certainly want to do that, because I have the skills and I have the ability to engage in large scale negotiations and conversations. But really, the everyday of what somebody needs to thrive has to be where I put my best energy.
Thank you, Dale. As you were speaking about these vital aspects that need to be addressed, and you just shared like a couple of examples with us. How long have you been working in these topics, Dale?
I would say that I started to take a hard look at vital conditions about 3 years ago.
Okay.
I know that because when you look at the social determinants of health, Sam, the way it is defined are those things that could be ameliorated to improve the person's living situation.
Mm-hmm.
But all of the definitions seem to put the onus for addressing it and ameliorating it on the person experiencing them. And really, in most cases, they are the person least likely able
Yeah.
to affect systems. And I didn't like that orientation. I struggled with it a great deal. I understand that those of us who are in a position to look at policy and to look at structures need to be really clear about the effect of structures and not be deluded and help those individuals who are part of a system where the structure is impeding access or quality care to try and preserve their interest in helping people and try and make changes in structures where we can.
Mm-hmm.
But the other side of it is those things are long term,
Yes.
are likely to take a lot of time. Whereas what I want to look at in many cases are community solutions where we can try and move forward in the benefit of somebody earlier than it might be possible if what we're going to do is just stick to straight up systems change and, challenging those social determinants.
Exactly. No, no, no. I completely see that. And I'm now curious to know a little bit more about you and about how you got involved in not only in these specific topics, but rather in the healthcare realm. So can you share a little bit with us about yourself?
When I tell people about my career path, that, there's always a lot of like, "Well, how did you do that?" Because I began, Sam, studying audiology, right? The hearing sciences with a focus on small children. I really felt like that was what I was going to do. And I chose not to. I went on in other directions and I did, child assault prevention through a rape crisis center. And I worked for Planned Parenthood, trying to do community education around reproductive rights. And in all of this, what was really clear to me is that I had the skills to look broadly at what was happening and make some choices about where I could direct my energy. But I had a child in 88, and his father is a photographer, a photojournalist, and he was documenting farm workers at the time. And the organization that hired him was willing to hire me to do special projects. So that was my entry into migrant health. I had no other access
Wow.
to it, but with time, had the ability to meet people who were working in health centers, who were out organizing farm workers, who were in the field doing, healthcare evaluations at health fairs and everything else. And I realized then that this was an area where I could really apply the skills that I had. And my interests were really turned towards initially infectious disease. So it was HIV and TB. Those two items came up hugely in the 80s, right? With the emergence of HIV, there was a reemergence of TB
Mm-hmm.
because the critical illness affecting people with HIV is TB. It's the number one killer of people with HIV now. So I continue to really be drawn into those conversations about the kinds of illnesses that are ancient and really need attention, particularly for populations who've not benefited as much as others. And this is how I got to where I am today. So how
Wow.
do I tell you what the path was? But I've been very, very fortunate. And that fortune has really taken me to working with some incredible people.
Now, so it's 36 years, right, that you have been working here. And I'm sure that in those 36 years, there have been hundreds, thousands of stories. Is there, Dale, any particular story that you remember that you could share with us that highlights the impact that advocacy can have on the life and the health of a migrant family?
I'm going to tell you a story about individual advocacy and advocating on behalf of a patient. The organization with whom I work, Migrant Clinicians Network, has a project called Health Network that does virtual case management, as I said earlier, for individuals who need care. And what I have to tell you is it's a young team. And for some of them, it's their first professional job. And they're coming to this, and it's really quite difficult to listen to the stories of individuals who've just been released from detention and they're pregnant and their partner has stayed. But what I want to tell you, Sam, is that the number of children that we've had named after our caseworkers, where we get a message, and this will likely make me cry, from a woman who said, I'm going to name my child Louise. I'm going to name my child Norma. I'm going to make sure Alma is a part of my child's name. That individual advocacy from one person who was willing to step into the breach with them, call a health center, get them an appointment, get them into care, make sure that they had a safe and accompanied delivery, then the proof of it is parents who are like so grateful that what they want to do is carry you with them for the life of their child. I can't think of anything dearer than that.
No, it's beautiful because, as you say, those are clear moments, clear ways in which we can realize how big an impact and how meaningful interactions are with people, especially people that are in a real need at that time. So thank you for sharing that with us, Dale.
Absolutely.
And I have another. When we're talking about what can be done, there's sometimes a lot of question about what physicians or nurses or healthcare workers can do, because I mean, there are different kind of issues that can be raised as like time to get involved and like what real impact can people have. What can you share with us, Dale, on your experience? What role can healthcare professionals play in making a real influence in policies that will affect migrant health?
Policies come at all levels, Sam. So I know mostly people think about national policies. And I will tell you that if there's any kind of legislation or action that needs to be taken in visits to the Hill, I find that physicians, clinicians of all ranks, have greater entree and greater cachet with those legislators than almost anyone because they're able to speak directly of patient care. So they do have a very strong voice that they can utilize. There are not generally lots of legislative opportunities at the federal level, though, because those things are mostly built around budgets, which, and, you know, the U.S. has been on a continuing resolution now for years. But where we do see them having enormous effect is at the state level as well. You can have a policy around exposure to pesticides for farm workers, and you can bring in a physician who's talked about the experience of receiving someone or receiving a group of people who've been exposed and what it takes and what it results in. And they are ever able to speak to the urgency of changing the law that protects people. And that's enormous influence. But the other side of it too is physicians and clinicians sometimes can have enormous impact on policies of the place where they work. It's hard frequently because it's, you know, huge healthcare systems. And where is the head of that system? It's hard to know. But if you can make a change around scheduling, we're going to make sure that we've got a number of open slots for workers to come whenever it is they can get to us. We're going to have a weekend clinic, one weekend a month, so that everyone who has to work Monday through Friday might be able to come in. So they can make some policy changes or recommendations to the site where they work that increases access.
Access.
And that's the issue that we're really looking for is how do you make it available to people?
Yeah.
Timing, transportation, acceptability, all of those things affect access. And I think clinicians are in a really strong position to be able to affect systems that direct that.
Yeah, no. I thank you for that because as you were sharing with us, like one word that kept coming into my mind was access. And that's true because like a lot of times, and we can see also, for example, in some other countries, it's not, for example, it's not an issue of people that they do not want to go and check like their health. It's that there's no access. Where can they go? Because either it's like the clinic is far away, or it's closed, or like the opening hours do not work for them because of their jobs. And as we speak of that, of those things, I wonder what other barriers besides access, which we just mentioned, that is a really big one. What other barriers do you think that migrant families face, and how can we address those other barriers?
I think one of the other big pieces for me that I spend a lot of time concentrating on is acceptability. In other words, you can throw open the doors and say everyone should come. And they're like, why should I come? You don't know me. You don't come to my community. What makes it acceptable is that they have people at the front desk who look like them, who recognize that they're, dressed, whatever,
Yes.
language,
Yes.
understanding of how hard it is to get somewhere, are able to help them with, some access to transportation. Those availabilities then make the service much more acceptable. If it can be approached and it is friendly and inviting, and it is engaging to them in the language in which they conduct their daily lives, and there's an appreciation for what their life is like. For example, Sam, I remember being at a health department in the South, and a woman came in and she was trying to sign up for prenatal care. And I leaned over, she was doing the form, and I said, be sure to do your birthday, month, day, and year. And she looked at me, she said, why? And I said, because your identification is going to be your first, your last name, and your date of birth. And in this country, and in no other country in the world, they do dates, month, day, and year. So it's just that one little thing. So she'd have been lost to the system forever, right?
Yeah.
And so she just is sort of like, okay. So just having people who are in a place to say to you, this is how the system works. Let me help you translate it for you.
Mhm.
Not just that we're here, but that this is what's going to be expected. That the way the system works is with appointments, that sometimes the appointments are really far away, but they might have a walk-in option. And the walk-in option may mean that you have to wait a while. But look at that, ask for it. All federally funded health centers, anywhere that gets federal money, ought to have translation. If you need language support, then you ought to say, I need someone to help me with this. Everything should have the ability for you to look at your eligibility for a sliding scale, or,
Mhm.
that there be some accommodation made for your financial circumstances. But you need to say those things out loud to people for them to know that they exist. And so that's what I mean by when something is acceptable, it is because you understand the patient's reality and you're doing everything possible to help them understand and navigate it well.
That that phrase that you just said, understanding the patient's reality. I love that, and that's a great segue to my next question, because um I wanted to ask you, and we're starting to get into the last part of our conversation. But what advice could you give to someone that is looking to make a meaningful impact, and people, if they want to get involved and if they want to support and fight for immigrant health, what will you tell them?
First thing that I would say, Sam, is go locally to a place that's assisting immigrants. There's a wonderful human being who's at the Equal Justice Institute. His name is Brian Stevenson, and he wrote a book called something Mercies, Just Mercies. Please excuse me. But in it, he talks about proximity. And the reason that people are afraid or they're unaccepting or they're not engaged is because we're not proximate to one another anymore. With the emergence of suburbs and our personal cars or whatever, we're not on the bus with other people and we're not living close to the center of town where we would then have encounters with people very different from ourselves. And he talks about the importance of proximity. And I believe that that's truly it. If you want to help, you must understand. And the way that you're going to understand is if you make an effort to be proximate to the people that you want to help. So go to the church that's doing food and clothes, or go to the worker protection place that's trying to talk to people about fair labor and knowing their rights, and meet people and extend yourself and come to understand their reality.
Could you share that same thought about proximity and going locally in Spanish?
Que sí, lo que le estaba contando yo a Sam es que quisiéramos hablar nosotros de acercarnos a la gente, porque lo que pasa ahora es que no estamos cerca a la gente. Ya vivimos en casas muy distantes y afuera de las áreas urbanas y tenemos nuestro coche, nuestro carro personal, así es que no nos tenemos que acomodar en el autobús y no nos encontramos y no nos conocemos. Y la más importante, se me hace a mí, cosa que podemos hacer, es estar cerca a la gente que quisiéramos ayudar, porque es importante conocerlos, saber cuál es su realidad, cuáles son sus necesidades, como ellos los ven, no como yo los veo. Y eso solo se puede saber en estar cerca de esa persona, hablar con ellos y entender mejor, como había dicho, su realidad.
Muchas gracias.
De nada.
Okay. And lastly, as we move to the last part of our conversation, Dale, when we are wrapping up these conversations with our guests, we usually ask them to share with us some like rapid fire question answer. So if I may, I will just like ask a couple of questions and let's see where we go. One of them, and I think you already answered it, is what is one book that you would recommend for people to take and read if they want to get more involved? And it can be either the one you mentioned, or if you have another one, please share.
No, you have to be honest and say Just Mercies is sort of a Bible for me. While it has to do with law and it has to do with communities of color and his work in pursuit of justice, I think justice is the theme.
Amazing. Thank you. Is there any like visual or audio material, either a movie or a documentary or a podcast that you will recommend people to take a look at?
I have to say, come to the Migrant Clinicians Network, our website, and look at some of our videos. We have one in particular that we did a few years back called Sheltering Hope, where we went to each of the immigrant welcome centers along the border, all the way from San Diego to Harlingen. We didn't interview the people who were coming in to the shelter. We interviewed the people who worked in the shelters and why they did what they did and what they believed was going on. And that in their hearts, what they were doing is they were sheltering the hopes of those people who were arriving in the U.S. I just think that that's so moving for me.
Thank you. And before going to the final question, I love the way you say why they do what they do, because that quote, Dale, is a quote that we at People Power Health, we use that a lot when we are sharing about public narrative and about the story of self. Why you do what you do is a key question in that process of sharing stories and storytelling. So thank you for that. And then finally, the last question, Dale, if you could go and have a cup of coffee, cup of tea, conversation with any person from the history of the world, dead or alive, who would that be and why?
Unfortunately, he just died, but I would go and have coffee with Gustavo Gutierrez, who was a priest in Latin America, who was one of the most outspoken, teachers of liberation theology. I need to understand how it is that we really try and focus on the moral, the ethical. Some people do it from a religious perspective. Some people, because they don't share that religion, then somehow believe that they don't have to share the behavior. And I would really like to understand from him his reasoning, if it is strictly because it, as an adherent of his faith, he felt that was enough. But then what does he say around ethics and morality?
Oh, amazing. Thank you, Dale. Thank you. Well, this is an amazing conversation. I love when we have a guest that loves to speak it, to engage. And if there is some Spanish in there, it's like a really extra special moment for me. Thank you.
Thank you so much for inviting me. And really, this is, like I said, these are topics that I could talk about for forever. So hopefully you and I will have a conversation again, just our own selves on a cup of coffee.
Of course. Thank you, Dale, and have an amazing day. Thank you, everyone, for joining us today.
Thank you.